So these are the radiographs for the foot for our patient. We have the AP view here, we have the oblique view, and we have a lateral view of the foot. What do you think about this lateral view, Katie?
Okay, so lateral foot, we should still see my shiny, happy talar domes in one line, which are not there. So it makes me sad. It makes me think this is not a great lateral. The bones are still superimposed, so that is good, but the domes are missing.
Yes.
We should see open joint spaces, which we don't in the ankle, but we do in the rest of the foot. And that fifth metatarsal should be peeking out, which it is, and the other one should be superimposed. So I'm going to give it a C- because my domes are missing, but the fifth metatarsal is peeking out like it should.
Exactly. So we're going to use our TBD criteria for this one. We follow the tissues here. The Keeger's fat pad is good. We see here the pre-talar fat pad touching the anterior aspect of the ankle joint. There's no joint effusion. Continue. You see here some soft tissue swelling around this area. No radio-opaque foreign body or emphysema. Next, we go for bones. We follow the cortices. We don't see any cortical step off in what we see of the fibula and tibia. Talus is fine. Calcaneus, we see some calcaneal spur here. And as we're moving here at the base of the fifth metatarsal, we see a cortical break here and a lucent line consistent with a non-displaced fracture. We follow the rest of the bones, don't have happy eye here, and we don't see any fractures. Last, we check the distances. What we're able to see, there's no dislocation. We go for the oblique view. What's a good oblique view, Katie? Is this a good one or no?
Okay, so that's the cuboid, and that should be completely like separate on all sides with good joint spaces. That's what you said, right?
Yes.
So I think it's too blurry.
Yeah.
They are like in the medial aspect. It doesn't look lonely enough like it should in a good oblique.
Exactly. There's superimposition here between the cuboid and calcaneus, even here between the navicular bone and cuboid.
And the metatarsals, the bases of 3, 4, 5 should be a little bit more separate, right?
Yeah, so there should be no overlap.
No overlap.
Yeah.
Another C-.
Yeah. And they're like minimal overlap at the base of the first and second metatarsal, which is fair enough. All right, again, we use our TBD. We don't see any tissue emphysema or foreign body. We see mild soft tissue swelling here at the base of the fifth metatarsal. Then we go for bone. We follow the cortices. And as you see here, again, we see the non-displaced fracture of the base of the fifth metatarsal. When you see a non-displaced fracture there, you need to check if it is extending into the fifth tarsometatarsal joint, which is the joint between the cuboid and the base of the fifth metatarsal, and here it's not. It's an extra-articular fracture. Then we follow the rest of the cortices, and we don't see any other fracture. Last, we check the D, which is the distance, and we don't see any dislocation there or any subluxation of the joints. Now we'll go to the AP view. Is this a good AP view or no, Katie?
Okay, so you said that metatarsal 2, 3, 4, 5 should be kind of parallel to each other and have they should have equal spaces in between. So I'll give that, they don't look 100% equal, but they don't look terrible.
Yeah.
And it should be more space between 1 and 2, right? So that looks okay. But you said this here, the cuneiform 1 and 2. So the lateral and the medial cuneiform. Middle. So it's lateral, middle, and then what's the third one called?
Medial.
Medial. Lateral, middle, medial. That's not confusing at all. Okay.
Yes.
So between 1 and 2, you should have a joint space that's open, and we don't see that.
Exactly. So there's overlap between the medial and the middle cuneiform there, and that's why you don't see the joint space.
I see that all 3 of these are non-weight bearing. Is that why perhaps they're not as good? Because when we bear weight, we naturally like separate out the bones in our foot the way they're supposed to be?
Exactly. And you're less likely to move between positioning and X-ray acquisition when you're bearing weight compared to just like non-weight bearing. And like they position you, and when the tech goes to check to take the image, you might move
a little bit. Okay.
All right. So on this one, we use the TBD2. We don't see any tissue emphysema or foreign body there. Next, we go for the bones. We follow all the cortices. And again, we see the non-displaced fracture of the base of the fifth metatarsal with no intra-articular extension. No other fractures or cortical breaks. And last, we check the D, which is the distance. I don't see any dislocation. Is this a good view to assess for Lisfranc?
No, because that has to be weight bearing.
Exactly.
I remember that.
So you need to have a weight-bearing
Bearing view.
radiograph
So-
of the foot to assess for less frank injury.
Because this person rolled their foot and they have pain on that lateral side where we see this fracture, even though these, I gave them all Ds or whatever, C minuses as an adequate view, would you need to send these back?
No,
But
because
you got
they,
your answer.
Yeah, they answered the question.
But if
they-
you're confused about something that you can't assess, then those had to go back to the kitchen and get redone.
Exactly.
Right?
And if they're worried for less frank injury, they need to get either weight-bearing or advanced imaging.
Okay. And for people that can't bear weight, like they don't want to bear weight, even if they have a foot injury, they send them to radiology to bear weight, they're going to stand on their good foot. So the best you can do is just to get them as quickly as possible just to stand on that foot and get a quick film.
Exactly. And if they can't, you just get MRI or
And,
CT.
okay, and you have to go to advanced imaging if you can't.
Yeah.
Okay.
So impression for this one, extra-articular fracture of the base of the fifth metatarsal
With slight soft tissue swelling.
with overlying soft tissue swelling.
Oh, okay.
Exactly.
I was so close to saying it exactly right.